Raise your hand if you've ever had to repeat your full medical history to a doctor for the third time in the same week. Now keep your hand up if you've had to carry around a USB stick, or, oh my favorite, a folder full of printed papers like it's 1999. The Dossier électronique du patient, or DEP, your digital health sidekick. Imagine this: you're rushed to the hospital, breathless, stressed. You land in urgence, and the doctor asks, "So what medications are you taking?" You mumble something about the blue pill, the little white one, and they have to guess. Now imagine instead, the doctor opens your electronic patient record, the DEP, and bam, there's everything. Your full medical history is there: allergies, test results, your vaccination record, even the time you broke your wrist falling off of a trottinette in 2007. No USB sticks. No, let me call my GP. Just your health data at your fingertips. Sounds perfect, right? Well, in the canton of Vaud, the DEP is real. Since 2021, thousands of patients have one. But here's the twist: no one had actually studied it until now. We studied over 1,500 patients, users and non-users, and also interviewed doctors, nurses, and physios. And here's what we found. Who uses the DEP? Mostly people with higher education, chronic illnesses, and multiple health professionals. They're digital savvy, have a love for gadgets, often wearing smartwatches and doing everything on their phones. Who doesn't? People with less digital confidence, questions about data protection, lower health literacy, less trust in tech, or who just can't be bothered. As one said, why spend my time on something that I consider a waste of time? Some users love it. Better communication. It's more transparent. I feel on equal footing with my doctor. Others, not so much. Opening an account, too complex. The system, clunky, not user-friendly. Medical jargon, incomprehensible. It's still Greek to me. And the big one, even if you have a DEP, some doctors don't use it, so the magic doesn't happen. Patients want easier access, a smartphone app, please, vaccination reminders, medication tracking, easy search, standardized document titles, and one small detail: professionals who actually use it. Early adopters are moderately happy. 2/3 would even recommend it, but without better design, training, clear leadership from health professionals, and political will, it could just stay another good idea that never takes off. A DEP is like the parachute. It only works if everyone agrees to open it before we hit the ground. The DEP can empower patients, improve safety, and make healthcare smoother, but only if we all commit. So doctors, patients, politicians, let's open it. Because in healthcare, crash landings are not an option.
Sorry, this machine is always going out of. We have to do it again. Initializing system. Again. Thank you, Catherine. Do we have a question? Did I call you Stephanie?
Yes.
Earlier. Yeah, but she's Catherine. Do we have questions for Catherine? Do you know how is it in country comparison? If you think about these digital patient records, are other countries like more open to this idea? I have the feeling that Swiss people are quite restrictive, giving their data and so on.
The picture is certainly mixed. We've looked at some other countries. Norway, for example, is really good. Estonia is really good. Rwanda is leading the way in Africa with some of their digital transformations. United States has several for-profit companies competing for the first place in that market. There's a lot of countries that are really behind the times, and especially in Africa and Asia. Swiss people, one thing that is really interesting about Swiss people, and we have this in our study, is that Swiss people are more concerned about data protection than some other areas. And so that's kind of one of the reasons why the adoption seems to be a little bit lower. Most of the resistance we found was not for that reason, but that's one of the reasons that there's resistance.
Yeah. For example, in Finland, there is this electronic patient documentation since many years, and it seems to work very well, and the patient can choose which information he gives in. But I can remember when I was with my late mother by doctor, and that was in a way, of course, she was like 85, so a lot of things that happened in her life. So before she went in, that was actually a nurse, so they knew already everything. So you don't have to ask always the same questions. You don't have to do radiographies and labor and so on, because you know already the story and so on. Yeah.
And our DEP is patient controlled. It's something that's special about the DEP, the way we've imagined it here in Switzerland, is that the patient's the driver, the patient's the owner. It's not a healthcare top-down approach.
Yeah.
It's the patient who decides.
Yes.
And that's actually really important because it changes the locus of control.
Yeah. Oh, very good. More questions? Okay, thank you, Catherine.